you've been dealing with lower back pain for months or even years and nothing seems to make it go away for good, I need you to hear this. The problem might not be your mattress. It might not be your posture. It might actually be the protein you are eating every single day. The protein you think is helping you. A research team led by Dr. Olivia Elma and Dr. Nijs at Vrije Universiteit Brussels studied people with ongoing lower back pain and found something most doctors never mention. What you eat directly affects how much pain your lower back feels. In the next 10 minutes, I am going to tell you which 3 protein sources are quietly making that pain worse, why each one hurts your back, and what to eat instead. Before we go any further, drop a comment right now and tell me one thing. How many years have you been dealing with lower back pain? Just the number. And if your back feels stiffest first thing in the morning when you wake up, add the word morning to your comment. You will understand exactly why that happens in about 3 minutes. Picture this. A 60-year-old man wakes up every morning with that familiar ache in his lower back. He makes himself a protein shake. He takes his anti-inflammatory pill. He does his stretches. He has been to physical therapy. He has had the MRI. But every single morning, the stiffness is still there. His doctor says it is just wear and tear. What nobody tells him is that the protein powder he has been drinking every morning for 3 years may actually be one of the reasons his back pain never fully goes away. That story is happening in millions of homes right now. And the answer is simpler than most people think. Here is what you need to understand first. The cushioning pads between the bones in your lower back do not have their own blood supply. They rely entirely on what is flowing through your body to stay healthy. If your blood is carrying a lot of inflammatory signals from the food you eat, those signals reach your spinal discs and the nerves around them. They make those nerves more sensitive and more reactive. You feel more pain, not always because something got structurally worse, but because your food is keeping your body in an inflamed state. Now let me tell you about the 3 proteins that do exactly that. The first one is farmed fish. Most of the salmon, tilapia, and catfish sold at grocery stores is farm-raised. Farm fish is fed corn, soy, and vegetable oil instead of natural ocean food. Researchers led by Dr. Frode Christoffersen, published in Scientific Reports in 2024, found that farm fish raised on those diets end up with far less healthy omega-3 fat and far more of an inflammatory fat called arachidonic acid. When that fat builds up in your system, your body turns it into a pain signal that travels straight to the nerves in your lower back, making them more sensitive and your pain more intense. The simple fix. Swap farmed fish for wild-caught. Look for wild-caught Alaskan salmon, sardines, or mackerel. Dr. Weiwei Deng and his team reviewed 9 clinical trials with over 2,000 patients in the Journal of Orthopedic Surgery and Research in 2023 and found that increasing omega-3 intake led to significantly less pain and inflammation. That swap alone can make a meaningful difference. The second protein is processed dairy, specifically the kind found in most commercial casein protein powders and conventional dairy products. Dr. Joe Tata of the Integrative Pain Science Institute explains that most American dairy contains a protein type called A1 beta-casein. In many adults over 50, A1 casein triggers an immune reaction that raises inflammatory chemicals in the body. Those chemicals travel through the blood and reach the sensitive tissues around your spinal discs and lower back joints, making your pain worse even when nothing structurally has changed. The Arthritis Foundation has highlighted research showing that switching to A2 dairy or fermented products like kefir reduces these inflammatory signals noticeably. The simple fix. Look for A2 milk at your store, switch to kefir, or use plant-based milk like oat milk. Your back will feel the difference. The third protein is commercial protein powder, the popular flavored kind in big, colorful tubs full of artificial sweeteners and a filler called maltodextrin. Dr. Emmanuel Cava and his team published a review in PMC in 2024 showing that these heavily processed powders can damage the lining of your gut over time. When your gut lining is damaged, tiny inflammatory particles leak into your bloodstream. Your immune system reacts. That triggers whole body inflammation. And Dr. Nijs and the Pain and Motion Research Group at Vrije Universiteit Brussels showed in the Journal of Pain that this kind of diet-driven inflammation directly makes your spinal nerves more sensitive and your lower back pain more intense. Maltodextrin alone has a higher sugar impact than table sugar. It spikes inflammation every single day. The simple fix: switch to clean collagen peptides with vitamin C. A clinical trial by the London Spine Unit, published in Nutrients in 2024, found that collagen with vitamin C directly supports the health of the cushioning discs in your lower back, feeding your spine what it needs to repair itself rather than inflaming it. Now here is a simple 2-minute test you can do right now. Write down every protein food you have eaten in the last 3 days. Mark each one as inflammatory or anti-inflammatory. Farmed fish, conventional dairy, and processed protein powder. Those are inflammatory. Wild-caught fish, kefir, collagen peptides, and clean pea protein. Those are anti-inflammatory. Count both sides. If your inflammatory column has more than twice as many marks as your anti-inflammatory column, your protein choices are very likely feeding your back pain. Dr. Artemis Simopoulos, whose research on this topic has been cited over 10,000 times, found that the average American diet runs 15 to 20 times more inflammatory than anti-inflammatory. The healthy target is 4 to 1 or lower. That gap is exactly why so many people's back pain never fully resolves, no matter what else they try. So here's what I want you to do starting this week. First, check whether your fish is wild-caught or farmed. If it is farmed, swap it for wild-caught Alaskan salmon, sardines, or mackerel. Second, look at your dairy and protein powder labels. If you see casein, maltodextrin, or artificial sweeteners, replace them with A2 milk, kefir, or clean collagen peptides with vitamin C. Third, do the 2-minute ratio test tonight. Fourth, give it 3 weeks on the new proteins. The Disc Health research found measurable improvements within 1 month. 3 weeks is enough time to feel a real difference if food is part of what is driving your pain. Here is what you now know that most people with back pain have never been told. Farmed fish raises inflammatory fat that makes your spinal nerves more sensitive. Processed A1 dairy triggers immune reactions that inflame the tissues in your lower back. And commercial protein powder with cheap fillers damages your gut and feeds whole body inflammation that turns up the volume on your pain. You know the 3 simple swaps, and you know the 2-minute test to check your own protein choices starting tonight. If this connected something you never heard before, drop the word clear in the comments right now. And please share this with someone you know who has been living with back pain for years and cannot figure out why it never goes away. That share could genuinely change things for them. Subscribe to this channel because this is exactly what I do here. I take research from medical journals and translate it into plain language you can actually use. This video is for education only and is not medical advice. If your back pain is severe, getting worse, or comes with leg weakness or numbness, please see your doctor right away.